questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So, Ms. Wayne, as this is your first appointment with me, I'd like to ask you a few questions and get to know a little bit about your medical history. It's also a chance for you to ask me any questions you might have.
Sure.
I understand from your GP that you have arthritis.
That's right, yes. It's in my hands and wrists mainly. The finger joints in my hands get really puffed up when they're swollen, like they are now. The pain can get so bad that it stops me doing a lot of very simple things. Things like having a shower or getting dressed. Then there's the trouble I have making breakfast. Anything where I have to grip and move my wrist, like holding the kettle and pouring, or buttering some toast. Well, you get the idea. It's not like I'm an old woman. I'm only 40.
I see. Tell me about your work.
I used to be a hairdresser, but I had to give it up after my hands started getting really bad. I couldn't just sit around the house and do nothing, though. So now I go to the local primary school where my kids are and help the children with their reading. And just lately, I've started helping out on the telephone helpline for people with disabilities. They have these special hands-free phones, so it means I can do the work without needing to use my hands so much. It's only a volunteer position, but I really feel like I'm doing something worthwhile.
Is your mobility affected at all by the arthritis?
I do have trouble getting in and out of bed or out of a bath. I also need help getting out of a chair if it's a bit low. I move around the house with the walking aid I have, and when I go out, I tend to use a wheelchair. Our car has also been modified, so at least I'm independent. I can go to the shops or out with friends.
I'm guessing you've had physiotherapy treatment before.
Yes. In the past, it's mainly consisted of heat treatment, but now I'm really interested in some sort of gentle exercises, if that's at all possible. I also really want to make sure that my hand splints are still helping and not making the condition worse.
Sure, I can look at that for you.
I've also been to an occupational therapist before. I needed help when things started getting really difficult around the house. I found her very helpful. She had lots of gadgets to help me do things like dressing and cooking, and so many good ideas about how to help with my tiredness without making the pain worse.
Okay, we can talk more about some of the techniques you use to help you at our next appointment. What about your medication?
I take analgesics for the pain mainly these days. I used to take those, those anti-inflammatory drugs, but the benefits seemed to wear off and they started making me feel sick, so I had to stop taking them. I do sometimes get a steroid injection, but not very often. It works really well at reducing the pain for a few weeks, but it hurts like hell. Dr. Wong has mentioned a steroid tablet I could take, which will work in a similar way, so we might be looking into that soon. And a couple of times a day I have an analgesic cream that I rub into my hands. I don't know if it really works very well though.
Extract 2. Questions 13 to 24. You hear a hospital neurologist talking to a new patient called Kathy Tanner. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Tanner. Pleased to meet you.
Hello.
Do you mind if we start off by getting some background to your condition? Just in your own words, could you talk me through the reason you're here and how it all started?
Oh, please, call me Kathy.
Right.
So, until 2 years ago, my husband was in the army.
Right.
We lived off base, and I had a job which involved a lot of driving.
Mm-hmm.
Whenever I was in the car, I noticed that my neck would get pretty stiff at times.
Right.
It was hard to turn my head. To cut a long story short, when my husband left the army, we moved to a new house. My neck pain was still a problem, so I decided to visit an osteopath.
Right.
He tried to fix the problem by a neck adjustment, but actually it just made things worse.
Oh, dear.
I found I was losing flexibility in my neck. I began to use a heat pad, which did help at first.
Good, but was not for long?
No. About a month or two on, I started to get this sort of feeling that something was pulling my head over towards my right shoulder.
Right.
It was painful and embarrassing because I couldn't keep my head straight.
Of course.
I'd managed to hide it from everyone around me until then. About this time, one of the doctors I'd seen thought physiotherapy might help and sent me to a nearby clinic.
Mm-hmm.
So I started going in regularly for treatments. And one day, the head of the clinic looked at me while the therapist was trying to position my neck and whatever. And he said, "You know what your problem is, don't you?" And I replied that I didn't. And he told me that I had spasmodic torticollis, and I had no idea what that was.
So what happened then?
So he says, "Oh, it's untreatable. You just have to learn to live with it." I went home in pain, feeling depressed and hopeless.
Yes, of course.
He was just so unsympathetic and unhelpful.
Well, I'm sorry to hear this.
Thanks. So, my diagnosis of spasmodic torticollis was in June. So I began to research, what I could do. I tried chiropractic treatment until December. It cost a fortune, but did no good.
Oh, dear.
The pulling and pain continued to increase. I saw a couple of neurologists, and I was put on a drug called baclofen, but it really didn't make any difference.
Yes, that wouldn't do much for your condition.
Oh, right. Anyway, the one really good thing I did at that time was to join a support group for spasmodic torticollis patients, so at least I knew I wasn't alone with the condition. But mostly, I just sat at home a lot. In order to get a bit of pain relief, I got myself an orthopaedic chair, and that did give me some support.
Right.
In November, I saw something in a magazine in the medical section. It mentioned some new treatments being done at the university hospital to treat things like spasmodic torticollis with Botox. We mentioned this to our GP, got a referral, and in December, I had the first injection in my neck.
And how did the treatment go?
Well, the injections really helped the pain, My head returned to almost a normal position.
Right.
It did give me a few problems, like problems swallowing, but that was okay. I thought I'd received a miracle cure. I was devastated when everything started to come back like before, and I went back to the hospital in May. At this time, the results weren't quite as good. Even though they'd upped the dosages, I ended up having 9 lots of injections, plus the, various oral medications. So I can't remember what they were.
No, it doesn't matter.
But nothing really made much difference. I just got more and more confused, and loss of memory became a problem too. Just for pain relief, they ended up giving me a pump so I could give myself morphine. Finally, I saw something in my ST support group's magazine about a relatively new type of surgery being done by a local neurologist, and that would be you. So, here I am.
And we will do our best to help you. Now, just a few more questions.
Part B, questions 25 to 30. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. Now look at question 25. You hear a nurse in the emergency department discussing the care of a patient with a doctor. Now read the question. So, who have we got here?
This is Adam King. He was brought in with a dislocated shoulder. He has Marfan syndrome, so we've seen him before with this. Last time he was here, the shoulder popped back in while we were putting his arm in a sling, and he was able to put it back in himself just by relaxing his muscles, but he's in quite a bit of pain right now, so he's having trouble calming down and getting those muscles relaxed.
Right, I see. So, do you want to start with some nitrous and some pain relief?
Yes, I think that's best, just until he calms down.
Question 26. You hear a trainee doctor discussing a patient diagnosis with a tutor. Now read the question.
Let's have a quick chat about the diagnosis for Janine in Ward 2.
Yeah, I was a bit unsure about that one. Because it's a young patient, it's not going to be diverticulitis, or...
Well, it's possible, but she is young, so yeah, it's unlikely. So, what do you think? What else could it be? What else happens in the bowel? Something common. Think about common things.
Bilateral lower abdominal pain? Because it's like radiating into the back?
Yeah, something very much more common than that.
Gastroenterological?
Yeah?
I can't think.
Possibly related to diet?
Celiac disease?
Perhaps, but there's not a lot of other symptoms pointing to that. What else would give you discomfort in the bowel? Lower abdominal pain.
I suppose if they're just constipated.
Right, yeah, constipation.
Question 27. You hear a hospital nurse briefing a colleague about a patient recovering from elective surgery. Now read the question. So, who have we got in bed 8?
Bed 8, Mr. Bernard Chambers, a 50-year-old man, had an elective bilateral inguinal hernia repair this morning. His wound is covered and dry and his post-operative observations are stable. Temp is 37, his blood pressure 140 on 70. He's already started eating a little and his walking is tolerated. Analgesia is written up, but he hasn't needed anything. He's planned for discharge tomorrow. His wife can pick him up. And he'll need a sick certificate for work before he leaves. Can you make sure he gets that, please? I asked the ward clerk to copy some post-op information for him, but I haven't had a chance to look through it with him.
Question 28. You hear two hospital managers talking about an information session for people who want to do voluntary work. Now read the question. So, how's the planning going for the future volunteer information evening?
Well, we've had a lot of RSVPs already, so I'm really happy with the way the event management systems have worked. Having a bit of trouble sourcing some good catering, though. Considering that these people are freely giving their time to come and learn what is expected, I really want to provide some nice food and refreshments for them. Have you got any contacts you like using?
Yeah, look, that's right. It's a small thing we can do for those participants. I'll tell you what, I'll ask around my team for some recommendations for something a bit special.
Great, thanks. I really appreciate it.
You hear a pharmacist talking to a doctor about a patient's medication. Now read the question.
Sorry to bother you, Dr. Anderson. I just wanted a quick word about Mrs. Campbell's prescription. The one for diphenhydramine that you gave her last week.
Oh yes, for her allergies.
Yeah, so she's been taking 50-milligram tablets for about a week now. The thing is, she's just been into the pharmacy and she says that the tablets are making her feel really drowsy and her mouth's really dry, ever since she started on the pills.
Really? Well, that does happen from time to time. But maybe switching her onto a different medication wouldn't be a bad idea.
Okay, I'll look into some options and then run them past you later, shall I?
Fine, thanks. Question 30. You hear a doctor advising a patient about a change in medication. Now read the question.
Now, the good news is that I don't think that antibiotics are going to help, so we don't need to think about those. And what I'll be advising actually is, from now, I'll be advising to start with a daily antihistamine. It's called cyterizine. I'll write that down for you because it is cheaper to buy than it is on prescription. And it probably is the number one choice for... I hope you don't mind this bit of scrappy paper.
That's okay,
here.
that's okay.
The number one choice for hay fever at this stage. This is 1 tablet a day. Now, for most people, it's absolutely fine. One person in about 100 gets a bit drowsy with this, so if you find when you've taken this that you get drowsy, then it could be this, and we maybe need to think of other options, and we'll come back to talk about that.
That is the end of Part B. Now look at Part C.
Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Extract 1. Questions 31 to 36. You will hear an interview with a sports injury specialist called Toby Walsh on the subject of hamstring injuries. You now have 90 seconds to read questions 31 to 36.
My guest today is a sports injury specialist called Toby Walsh. We're going to be talking about hamstring injuries. Toby, hamstring injuries are something sports people at all levels of ability fear getting. Why is this?
Well, you're right. Hamstrings are the most significant injury in a number of team sports, including football and rugby, but any sports person could be affected. I think, looking at the statistics, hamstring injuries account for the largest number of lost playing hours amongst professional footballers, even though the average injury only takes about 3 weeks to heal. More worrying for the individual is that once they've had such an injury, the chance of sustaining another one in the same season is as high as 20%, so it can become the thorn in the player's side. That, I think, accounts for the reputation the injury has.
So is this an injury that can affect any of us at any time?
Well, the hamstrings are a group of muscles in the thigh that allow us to bend our legs and knees effectively. Now, some ethnic groups are more predisposed to these injuries than others, and everyone's chance of tearing the muscle increases with age. But apart from that, they're generally the result of short bursts of movement, like sprinting or suddenly changing direction, and they happen more in certain sports because these are just the sort of movements that players are making. They happen most often at the end of what we call the swing phase of running, just before the outstretched leg hits the ground and the muscles contract to bend the knee.
But I'm sure there are ways to prevent these injuries.
Well, looking after the muscles themselves obviously helps here. You can do various exercises that actually strengthen the hamstrings and so make them less prone to injury. And of course, warming up before exercise is crucial in avoiding all sorts of muscle strains, and sports people know that. But that isn't the whole story. One interesting finding is that a lot of people who develop hamstring injuries have coexisting back problems, and there would seem to be a correlation. By loosening up the lower back, you also help the nerves that control the hamstring. Flexibility there allows the muscles to function as they should, and there are exercises people can do to help that.
And is the risk of hamstring injury something that should be taken into account in training programmes?
Well, yes. Intensive training, of the sort you do for team sports like football, can put quite a heavy workload on the gluteal muscles, which can lead to a tightening around the hips, creating knots known as trigger points. These, in turn, can cause referred pain in the hamstring, reducing flexibility and increasing the risk of straining or tearing it. I mean, basic stretching exercises can help here, but also we know that muscles are more likely to strain if they're fatigued. Often, during a period of intensive training, you get cumulative fatigue. This can creep up on an athlete, on their muscular system over a number of weeks as the training intensifies.
And if an athlete does pull a hamstring, how can the sports injury specialist help?
Well, they'll feel the pain, maybe even feel a pop, and they won't be able to continue because the muscle will go into cramp and spasm. There are 3 degrees of severity, and the treatment will vary according to that. Fortunately, as a sports injury specialist, you're often present when the injury occurs, or you can see it on video, so you don't have to rely on a verbal account of symptoms to assess the severity. Initially, you want to stop any swelling as soon as possible. That's your priority. You're going to apply compression bandages and possibly ice. Although there's some debate about that these days, it does ease the discomfort. And you'll certainly elevate the leg and make sure the patient rests up.
And how long will the athlete be out of action?
Well, as I say, that's going to depend on the severity of the injury. They'll have to rest up for 72 hours, whatever happens, to avoid causing further damage. And things like heat and massage can be just as damaging as movement itself.
Oh.
A grade 3 injury can take months to heal and can be career-threatening for top athletes. What's more, lack of use can lead to the development of scar tissue and muscle shrinkage. In other words, the muscles won't return to their former state, even if the tear or strain itself heals. So part of my job is to ensure that doesn't happen by getting the muscles working again in the right way as soon as possible.
Which comes from Mel, who asks if soy milk is messing with our hormones and if there are healthier milk alternatives. We're joined by Olivia Willers.
Hi, Michael.
A lot of us tend to think of soy milk, live as a healthy option. You can find it in the health food aisle of many major supermarkets. What's it actually made of?
It's funny, a lot of us do tend to think of soy milk as, and I guess any other kind of plant-based milk as a healthier option or a health food. And it's certainly a lot of reason that people make the switch now, not just because they're, lactose intolerant or maybe they want to reduce their carbon footprint. But soy milk, it's essentially made from soybeans and filtered water. So it's kind of taking the milk from soybeans that have been pressed, or in some cases manufacturers will use a soy protein powder. And then they add in things like oils and sweeteners and salt to get it to that similar kind of consistency and flavour as cow's milk. And it's also normally kind of fortified with calcium and vitamin D and certain B vitamins, just so it becomes a good, substitute for cow's milk and a good source of calcium.
Okay. So how does it compare nutritionally to regular cow's milk?
Well, nutritionally speaking, it's pretty on par. Soy milk that's fortified is fairly similar to dairy milk, and that's most of the soy milk that we'd find in the supermarket. There's no reason why anyone needs to have dairy milk or cow's milk, but it's certainly a good source of protein and calcium, and it's an easy way, I guess, to get a lot of those nutrients that we need in our diet. That's kind of why it's been a cornerstone of Western diets for a long time. Cow's milk is generally, it's naturally a better source of calcium. But like I said, because most soy milks are fortified now with calcium, they're a really decent substitute for cow's milk. Soy milk's a good source of protein, and soy products, should be a good part of a kind of healthy, balanced diet.
What about fats, comparing milk with milk?
Yeah, so soy milk is it doesn't have, the same, it's lower in fat, it's lower in saturated fat, but milk products generally are fairly low fat. And I guess if you're concerned about the fat content, you've got kind of skim milk as an option, but that is something, I guess, to take into consideration, that yes, soy milk is lower in fat content.
So soy is also lower in fat, but as I think you mentioned, it's fortified, so along with the natural qualities of soy itself. So you've got iron and fibre, other vitamins and minerals. So is there a kind of recommended blend between dairy and soy in your diet?
Look, I think it's really personal choice. Like, soy is definitely the best kind of substitute for cow's milk. If you're going to not have regular cow's milk in your diet, then soy would certainly be the best option, in contrast to other plant-based milks like those almond milks. Yeah, absolutely.
Okay,
by a long shot.
Well, we'll go back to some of those other milk alternatives in a moment, because a lot of people are opting for those too over soy and dairy. But just back to Mel's original question, she was asking, is soy milk messing with our hormones? And what's the science saying there?
Yeah, so people were a little concerned. There was concern some years ago about this. So soy products contain these things called phytoestrogens, and they're kind of naturally occurring plant chemicals that are chemically pretty similar to the body's natural estrogen, but, they're of a much weaker scale. And soy is not the only food to contain them, but it does have a high concentration of them. And so I guess the discovery of phytoestrogens in soy products led to concerns that they would kind of mimic the effects of our body's own natural estrogen and potentially disrupt our hormones. And there was a particular concern that was raised some years ago when researchers found basically that these phytoestrogens could increase the risk of cancer in rats. But it's very important to point out that animals, rats have a very different metabolism to humans, and studies in humans do not point to any kind of harmful effects.